Звезды мировой пластической хирургии с Ольгой Засеевой. Эстетика в разрезе. Деннис Хаммонд, США. Легенда пластической хирургии. Профессор, доктор медицины. Автор более 100 научных работ по мамопластике и контурной пластике тела. Один из самых известных и авторитетных специалистов в своей области.
Do you remember first time when we met?
I think it was at the meeting that you run here maybe even more than 10 years ago.
Exactly, and I remember that you told me, Olga, it's so unusual for me to be in Moscow, to sit in the car, international car, and drive easily.
I was so thrilled actually to visit Red Square, because we had seen that on TV many times in the past.
Yeah, it was a good feeling, and I think that for the first visit to Russia, it really was exciting.
It was a lot of fun.
We still have some people who never been in Russia, so we hope that we will show them opportunity to come to Moscow for the Moscow breast meeting next time.
Absolutely, I think it would be wonderful.
Эстетика в разрезе.
Is it more people now willing, more ladies willing now to do the breast surgery than before?
Well, I think that nowadays, with the advent of social media, patients are much more well informed, and they know which questions to ask and how to find the right doctor for them. And that also adds to the better results that I think that they're getting.
It's interesting. What did they ask when you come for the consultancy?
Well, they have already researched me by the time they're sitting in front of me. They've talked to Dr. Google, and there are many reviews that are out there. And they've also researched the procedure they're interested in. So they're very well aware of the various techniques that are available for whatever procedure they're looking for. And so they have a good idea what they want even before they come through the door. So at that point then it's just building a relationship between the doctor and the patient so that you can move forward with a successful procedure.
So did they ask for your advice, or they come and say, okay, I would like this size, and that's it? Or it's a discussion?
I think they're definitely looking for my advice, but it's also very comforting for them if I say what they already know. So that makes them much more comfortable with the whole process.
And they know about the product, they know about the procedure?
They know about the procedures. Sometimes they don't know quite as much about the different products or the different types of implants that are available. And that's where we do a lot of educating ourselves.
So what are the major questions about the implants they're asking?
A lot of them are interested in information concerning the difference between a round implant and a gummy bear implant, or the teardrop anatomic shaped implant. These days, a lot of people are coming in with questions about smooth implants versus textured implants, and in particular the issue of the anaplastic large cell lymphoma. And then as well, a breast implant illness, they want to know about that as well, because there's a lot of that out in social media right now.
Звезды мировой пластической хирургии с Ольгой Засеевой. Эстетика в разрезе. Гуру мамопластики, профессор Деннис Хаммонд.
We have a very famous lady. She took off the implants, and then she made a publicity out of this procedure, and then we started to receive from our colleagues, doctors, information that the patients want to take off implants and not to replace them. This is a little bit stressful for industry, let's say, and for understanding why and what is the reason. Do you have the same issue with your patients who are just afraid of implants?
Yes, this is stressful for everyone all around the world. This issue of implant removal for these, what are oftentimes very vague and ill-defined symptoms. So there are many people, myself included, that are somewhat skeptical about whether or not these are actual diseases. So it can create a very uncomfortable situation where you're doing an operation to treat a disease that may not actually exist. We just don't know for sure. So this is where it's going to be very important that we continue to do research and get to the bottom of this problem. In the meantime, this is where you can counsel patients and try to help them make good decisions for their health and their appearance.
Эстетика в разрезе.
Dennis, what is the future of the, let's say, breast surgery in the near future? Is it going to be like 3D printer where you could modeling the breast and then you don't need a plastic surgeon?
I think, no, you're always going to need a plastic surgeon, but we are going to get much better at this. And I think one of the areas that will make a lot of advancement is in what's called regenerative medicine. So there could come a day when we could grow the patient's own tissues in a laboratory and put them back, like with fat grafting, to accomplish our reconstructive needs. I think we'll also someday have much better breast implants. We may well in the future look back and say, do you remember those old days when we used silicone gel breast implants? Because now we have this. So I think these advancements will just continue and continue on through the years, and I hope, it is my dream to live another 30 years, because I can't wait to see what happens in the future and what we're going to have.
Эстетика в разрезе.
It's interesting. What do you think could be done instead of the implants? I think it should be something which will be covered by protecting borders.
Yes, that's where the regenerative medicine comes in. We'll be able to perhaps wrap the implants with a material that's very cell-friendly to the patient so that the body doesn't recognize it as a foreign object. That'll eliminate a lot of the problems that we've had with breast implants, like capsular contracture and infection and complications like that. We're almost there. I can use an implant-based breast reconstruction now in a lady with breast cancer, use that implant in combination with the patient's own fat and some matrices, some meshes inside the breast to do some amazing work and accomplish very good results in breast reconstruction.
Звезды мировой пластической хирургии с Ольгой Засеевой. Эстетика в разрезе. Гуру мамопластики профессор Деннис Хаммонд.
The question is important. We have a lot of in the auditorium questions to you. And do you have anyone you could ask the question, or you need, if you need, for instance, anyone to whom you trust, anyone which opinion is important for you, from your colleagues?
One of the great advantages that I've had is that I have friends now all over the world, some of the best plastic surgeons in the world. If I ever have a problem, I can call them up and say, have you ever seen this before? What do you think that I should do in this particular situation?
How often it happens in your practice?
Not very often, just a couple of times over the years. But I can tell you a funny story.
Yeah.
I was at a well-known meeting in the United States about the breast, one of the biggest breast meetings in the world. And I was at the faculty dinner. So I was in the room with 30 of the best plastic surgeons in the world. And my daughter sent me an emergency text. She had splashed some hot oil cooking on her forehead, and she had a burn. So I showed the picture to 30 of the most famous plastic surgeons in the world, and I said, what do you think? Should we do something? And fortunately she was fine, we didn't need to do anything else. But that was a lot of fun, because I sent her a text back. I said, well, I have an opinion from the best plastic surgeons in the world that you're going to be okay. So that was kind of a fun little story about how you've been able to develop relationships with people around the world that can really work to your advantage.
Эстетика в разрезе.
If you will be making a composition of the woman, what size of implants you will think will be ideal for the young new model?
Well, I do think that the breast, like I said, visually it just evokes all kinds of emotions, artistic emotions, and it does have to have some form to it. So it's so difficult. We call breasts, B cup, C cup, D cup. I think the ideal breast, to put it in terms of patients, would be a full C. I think that sets off the proportion to the rest of the body very well, and that's what I would shoot for. In the United States, that would be somewhere around a 300 to a 325 cc implant most times.
Do they often follow your guidelines that you suggest this kind of volume, or they say, no, doctor, we would like more?
No, most times they'll listen to me, because they know that that of all of the people that are in the room, I'm the expert.
So tell me about the patients. It's an interesting question for me because if they go, for instance, to your practice and then they go to another different doctors as well, and they don't choose you, they choose another doctor. But then when it's failure, they come back to you and they ask, oh, please, Dr. Hammond, could you make something to make it better? Will you double charge for this one, or will you do this? Will you try to?
Number one, will I do the procedure if I think that I can help? And I would never dream of double charging somebody just because they went somewhere first. Because think about it, here's a patient who is suffering, they've had a complication, and it's another human being. So we have an obligation to try to help those people. So the charge for surgery is what it is, no matter where they come from.
So complication doesn't cost more than, let's say?
Oh, you know, sometimes if it's a really involved case, they can be quite expensive. But we don't ever adjust the charge because I was their second choice. They need to think about going to see somebody who is properly trained, has experience, and is going to be able to do a good job for them the first time. The minute they start looking at price and trying to say, in the United States we have many people who will fly to Mexico because it's very cheap to have surgery there. Well, cheap surgery, cheap result. And then when they have their complications, they come back, and of course now it's going to cost them 2 or 3 times as much to have the problem fixed. So if they had just had the procedure done with a well-trained person in the first place, they would have been much better off.
Звезды мировой пластической хирургии с Ольгой Засеевой. Эстетика в разрезе. Гуру мамопластики профессор Деннис Хаммонд.
When did you feel that you would like to share your experience and your knowledge?
From the very beginning.
Really, because I have a lot of cases when I ask doctor to be our mentor or to participate in meetings to teach, and they told me no, we don't want to tell our secrets.
Oh, no, not at all, no.
So you're happy to share?
Oh, it's right in the Hippocratic Oath. This is an oath that you take as a doctor. So, because we're terrible businessmen. We give away all our secrets, because that's what we're supposed to do. If I've learned something or have developed a technique that helps patients, it's my job to tell that to everybody else so they can help their patients. That's just the way that we're supposed to react as doctors.
And then what about competition? If someone will be doing the same as you are doing, then?
I hope they do it better.
From the yesterday session, what was the most fun or interesting question from the auditorium, from the Russians?
No, I remember exactly, because one of the things that I've tried to teach the surgeons here at the Moscow breast meeting was the importance of the lower pole arc of the breast.
Yeah, it's the biggest questions. Do we need to go lower or not, and how to save?
Exactly. And one of the Russian surgeons asked, what about the patient where the skin is going to stretch? Does that mean I need to make an adjustment in the lower pole arc? And the answer, of course, is yes. But I really like that question because that told me that they were understanding what I was trying to teach. And that is always satisfying as an educator, knowing that the message you're trying to give people is being received. So that was fun.
Эстетика в разрезе.
So what will be your then suggestion for the doctors?
Always go to meetings, always talk to colleagues, always question yourself. How can I do better? The best compliment that I was ever given was somebody once said of me that I would never take no for an answer, but I would also never take yes for an answer. And that means that no matter how well I did with a particular case, I was always striving to do better. And that's a good philosophy for life.
So how many procedures are you doing per week in your OR?
Yeah, in my office, in my practice, I typically will do anywhere from 6 to 8 procedures a week.
Wow.
But it's very busy. They're very busy days, and then of course I go to many meetings such as this, the Moscow breast meeting. I go to meetings all over all over the earth, all over the world. And that's how you get to be a better surgeon, because you get exposed to different ideas and different philosophies of plastic surgery.
So in your practice, the patients who are willing to do the cosmetic, is it 50-50 or it's more reconstructive patients? How did you choose them, or they choose you?
Well, for me, in my practice, I'm about 50% cosmetic, but 50% reconstructive as well. And I try to maintain that reconstructive side of my practice, again, just because I enjoy it so much. It really is a privilege to be able to work with these ladies and help them recover from breast cancer.
So how do you, make fun in your art? Do you listen music?
Oh, yeah, always. We listen to music every case. Yes, yes. Classic rock.
Classic, okay, super.
Звезды мировой пластической хирургии с Ольгой Засеевой. Эстетика в разрезе.